December 20th, the very same day that she had finished being evaluated, woman you were invested in, had been evaluated by Dr. Diaz that you recommended or you mentioned, that in fact, looking at the exhibit, that they recommended tapering Seroquel, starting 200 milligrams tonight, follow up with outpatient provider of note. We attempted to reach current outpatient provider Rebecca Gelada, but did not receive a call back.
I never received a call from Women and Infants.
So this medical record from Women and Infants saying that they called Rebecca Gelada and never got a call back, your memory is that they never called you?
They never called me. I absolutely would have called them back.
Okay. Well, regardless, you never talked to anybody from Women and Infants, did you? Whether they called you or whether you reached out to them being invested?
I did not. I know our program re-referred her a few days later.
What is Aspire Crisis Support?
Aspire is the community mental health program that operates the local 24-hour emergency services program for psychiatric emergency services.
Okay. So when I say you collectively, I mean psychiatrists, nurse practitioners, RNs in the psychiatric world, tell patients that are in crisis that if you feel that you're going to have suicidal ideation or anything, that you should call these numbers, is what your people will give them, right?
Yes.
All right. She called Aspire Crisis Support, not once but twice, right? If you know.
I'm aware of the one time she called.
Okay. But she was not given any help at all by Aspire, whoever they are, right?
I'm not aware of that.
Well, it says right in the records from Letitia that she met with an Aspire clinician virtually and was told that she did not meet the criteria for inpatient treatment due to not having an SI plan. What does that mean? They just told her you're not laying on the ground with your throat cut, so we're not going to be able to help you?
Can't speak to what they told her.
So Aspire then recommended that she start or go to a day program. Is that correct?
That's correct.
And the clinician said that he, from Aspire, would be sending the patient resources, right?
Correct.
But they never did they? If you know.
I don't know.
Pat, patient's husband, joined the visit, reporting that her anxiety had become significantly worse since starting the psychiatric medications. Did that say that?
That is what that says.
Okay. And in fact, when you spoke to Pat, he had told you that, in his quotation, or his words would be, it was 10,000 times worse since she started this medication, right? If you know.
I don't recall him using that phrase.
But he was upset about the medication, wasn't he?
I would say he was concerned.
Do you recall that he said that you're turning her into a zombie?
I do not recall that he said that.
So would you say to the jury that he was concerned or he was pissed off about the medication and what it was doing to his wife?
Objection, Austin answered.
No, overall.
I would say he was concerned.
Concerned? Okay. Did anybody address his concerns?
That day,
Any day?
I would say that day, I collaborated with them to take her off certain medications.
Did you know that she had lost over 15 pounds by that point?
I was aware she had lost some weight. I was not aware that it was 15 pounds.
There was a period of time that she indicated that she wanted to get off the medication and get off the drugs, and you indicated, as you told us, that you were on vacation that week, right?
Yes.
You basically told her to tough it out and just hit me up when I come back from vacation, right?
No.
Did you tell her to call you when you came back from vacation?
No, I asked that she try to hold off and wait for me to come back from vacation for the taper. She had wanted to taper it sooner.
Would you agree that Patrick, in this conversation, also indicated that she was having intrusive thoughts, yet again? Right?
Correct.
what were the intrusive thoughts that she was having when she wakes up with panic symptoms?
I don't recall the specific intrusive thoughts. I recall asking about safety and that she did identify having thoughts of suicide.
Well, Patrick told you that she has thoughts of suicide, right?
Lindsay as well.
Okay, so I'm asking you what you, as an invested healthcare provider, told this woman to advise her what your investigation revealed. If you have a patient tell you, I'm having intrusive thoughts, what were they?
I recall that they were intrusive suicidal thoughts.
And is this a frequent theme that you noted?
I don't know if it was a frequent theme that I noted, but I know that it was documented several times throughout her course of treatment with providers in my program.
So at this point, with all the providers of your program and her indications, as well as her husband's, about the number of times that she had suicidal ideation, did you prescribe more drugs for her?
At this occasion, I prescribed Valium.
You bumped her up to Seroquel to 400 milligrams, didn't you?
Yes.
As I read the record, which is an exhibit, Women and Infants, December 20th, differential diagnosis, concern about medications, reaches out to Rebecca Gelada, no return call from Gelada. You don't recall that. You don't know what happened to her after that, do you? Other than going to McLean.
I know that she went to McLean.
Right. Do you know when she went into McLean?
At the end of December, early January.
Okay. Did you review the McLean records? Because you have access to them, right?
I do not have access to them.
You don't?
I don't.
So if you're treating a person for all of the stuff that we've talked about, and it's now apparent that things have decompensated so bad that they have voluntarily admitted her to a locked ward in a mental institution, is it important to Rebecca Gelada to find out what the diagnosis and treatment was of their patient?
Yes.
Did you find out?
I did not.
From your treatment of Lindsay and her efforts to be a good patient and tell you all what her symptoms were and third-party contacts and everything, to your opinion, she would have signed a release for you to get access to pretty much anything you wanted, right?
I'm not sure if she signed a release for McLean to be able to speak with us.
Did anybody ask her? Did you ever ask her to sign a release?
I did not.